In the public health world, we say that the next pandemic is only a plane ride away. And so knowing how people travel, we knew that it was only a matter of time before it came into North Dakota.
We at NDSU, in our graduate program in public health, had one of the few infectious disease training tracks in the country. So we were already training the next generation of public health experts in an area that was tailor-fit to this pandemic.
It was a real challenge, and we had to bring everybody together to try to meet this challenge in unique and different ways than anything we'd ever done before.
Good afternoon. Thank you for joining us. I'm John Glover, president of the North Dakota State University Foundation. Under normal circumstances, this would be the time of year that we take the NDSU show on the road with programs in Florida and Arizona and all points in between. But as the pandemic rolls on, we, like all of you, are adapting to new environments. While we all wish that we could be together in person, we're coming to you here from the McGovern Alumni Center on this beautiful February day, and we're happy you have chosen to take time to be with us. As the pandemic has influenced our lives, there's been some really great work happening by our faculty and students at NDSU. Throughout the program, we'll pull back the curtain on some of the work our faculty, staff, and students have been doing to help track, understand, and solve the COVID-19 challenge. We'll hear from several members of NDSU's Department of Public Health to learn more about the program and the role students play as state contact tracers. Dr. Pamela Jo Johnson and Dr. Paul Carson from the College of Health Professions will also join us to talk about their roles in working with the state to advance the education about the virus. And we'll visit with Brenda Vincent, a PhD student in the statistics program in the College of Science and Mathematics, who's working on several research projects for the North Dakota Department of Health. We'll also get a campus update from NDSU President Dean Brashani and hear from In Our Hands campaign co-chair Marianne Swantek and provide an update on this historic fundraising effort to support NDSU. Well, it turns out that President Brashani is here now, so thanks for joining me, sir.
Thank you, John. Thank you, everyone.
It's good to have you here, and I think it's obvious we need to start with a COVID update. And what are things like on campus these days?
Well, it's been very exciting. NDSU really has led our local area community and our statewide community in dealing with the COVID update. Aside from the things you're going to hear about as far as our faculty, staff, and students being the frontline responders to the COVID pandemic, I can't say enough for the students, the faculty, and the staff, and their level of cooperation and aggressive responsiveness to the demands. We are leading the state with a less than 1% positivity rate. We have 3 active student cases, 0 active faculty or staff cases. That's pretty extraordinary when you think of the NDSU community of basically being 25 to 30,000 people. To have 3 cases is really extraordinary. We're also looking forward to the vaccine coming to campus in the near future. Our faculty and staff have had an elevated level of priority for the vaccine, and what I anticipate is that we're going to see a return to normal probably at NDSU and in our area sooner than anyone else in the state.
Yeah, it's fantastic to hear. So certainly NDSU is about education and the learning environment, and we had to adapt given the pandemic. Can you talk a little bit about the technology that NDSU installed last fall to really carry us through this year?
Yeah, it's an exciting question, John, and really extraordinary technology. We've all heard about online, but this is not online. What we did was install technology in every non-laboratory classroom on the campus. Every single non-laboratory classroom on the campus, including rooms in the union and including places in the library, that allowed students to participate in their class synchronously, in other words, live, even if they weren't in the class. And similarly, for the faculty to teach the class if they weren't in the classroom. Now, you may say, why wouldn't they be in the classroom? Well, obviously, in quarantining and isolating people, or in the case of faculty and staff, the more common concern are predetermined health risks. That allows classes to continue on a normal basis. Faculty can ask students questions, students can ask faculty questions, live and in person, regardless of the location they're in. That allowed us to keep more people in the classroom, but more classes going, more students moving toward graduation than any other college and university in the state of North Dakota. Everyone since has caught up to us somewhat, but there's nobody who did it as quickly and in every classroom on the campus as we did. And we think that's a big part of why we have not seen the drop-off of students that a lot of other colleges and universities, not just in North Dakota, but across the nation have experienced.
Well, I think that certainly speaks to the spirit of the NDSU community and pivoting and responding to an uncertain time, and certainly breaks the mold of the way we typically do things. And I think that's a credit to you and your leadership team, and most importantly, the faculty and students for adapting. You alluded earlier, the vaccine is coming into the communities and will soon be here for NDSU as well. You know, Bison football just had a nice win to open the season on Sunday. We know that there's hope and optimism, I think, on the horizon. Can you just reflect a little bit on the future for NDSU?
Well, it's exciting because everyone wants to get back to that normal. And I think while our students, faculty, and staff are being more cooperative than any place else I've seen in terms of maintaining good health practices, they're doing the things that will get us back to normal. We're putting chairs back into classrooms so that more students can be in the classroom. Each of the past 2 weekends, we've had 12 or more athletic events going on, either on campus or off campus. Those are allowing 50% occupancy in all those venues, with the exception of soccer, which is in the Dakota Field bubble, and there's no room for fans. But people are pouring in. People are hungry to get back to normal. They're hungry to be back in the classroom. And it's pretty exciting to see, again, while people aren't throwing out caution, they're using appropriate measures to get back as close to normal as possible. We are promoting with our incoming students next fall that we will be back to a full normal as any conditions would allow. But by then, we certainly anticipate, unless things went in an unanticipated manner, that we will be back to a true normal. And everybody's excited about that.
Yeah, that's
little
right.
steps matter.
Yeah, that's fantastic to hear. I know for prospective students and their families, that's important as they think about the next step, and it's important to the future of NDSU as well. So really appreciate the updates. We'll come back to you in a little bit. You know, these past few months have been a testament to NDSU's commitment to student success and doing it all it can to nurture that Bison learning experience. We also know that philanthropy plays a vital role in supporting our students, which is why we publicly launched In Our Hands, the campaign for North Dakota State University, nearly 18 months ago. Despite the challenging pandemic environment, response from alumni and friends has been incredible. And I'm happy to share that we are less than $10 million from reaching our $400 million goal. Dr. Brashani, what do you have to say about that?
It's really unbelievable. Under these conditions, to have accomplished this a year in advance of the campaign's end is extraordinary. For us to have accomplished the largest campaign in North Dakota history in itself is an accomplishment. We have had everything stacked against us. And the people out there joining us today are exactly why we've broken the curve that should have taken place. Congratulations, John. Congratulations to all the supporters of North Dakota State University. Your passion and your support of what we do is going to reposition us for a long time to come.
Throughout the campaign, we've had tremendous support from In Our Hands campaign co-chairs and ambassadors, volunteers, who have helped spread the word about what this means for our students and faculty. We caught up with one of our co-chairs earlier to share a few words with all of you. Please welcome campaign co-chair Marianne Swantek.
Thank you, John and President Brashani. It's been an honor to be part of NDSU's campaign In Our Hands. Steve and I want to send our greetings to all, and I know that you anticipate our being able to connect in person just as we look forward to. Steve and I were blessed by our choice to go to NDSU, where we first met, and we made lifelong friends and we both earned a degree that led to fulfilling careers and opportunities. We've been excited to work with Bob and Sheila Challey on this campaign to be co-chairs, and we are thrilled to be so close to this historic goal. With the support of all, this university will have the opportunity to reach the level of excellence that will provide answers to the challenges of the future. This year, it's been obvious that we rely on those solutions, especially from science and math, to continue our way of life safely. If you haven't already joined us, I invite and encourage you to participate in this opportunity with your gift to the campaign today. Be a part of the excitement and the sense of accomplishment to make a difference in the lives of the students. With every dollar you share, you will work to create change. Let's finish this campaign Bison strong, because the future is truly in our hands today.
Thank you, Mary Ann. The pandemic has altered all of our lives in the past year. We heard the president reflect on the resilience of students, faculty, and staff. Let's learn more about an area on campus that has been working in collaboration with North Dakota's Department of Health to respond to the pandemic over the last year. NDSU's Master of Public Health program offers specializations in American Indian Public Health, Community Health Sciences, Epidemiology, Food Safety, and Management of Infectious Diseases. Earlier, I met with Dr. Pamela Jo Johnson, the Mary J. Berg Distinguished Professor of Women's Health and Chair of NDSU's Department of Public Health, to talk about the program and the work of NDSU students. Let's take a listen. I'm joined now with Dr. Pamela Jo Johnson, Associate Professor and Chair of NDSU's Department of Public Health in the College of Health Professions. Pamela Jo, thank you very much for joining us today.
Thank you, John. It's my pleasure to be here.
We're about to watch a video that lays out the important role that our students, faculty, and staff played in helping with contact tracing across the state during the COVID-19 pandemic. But at a higher level, can you just share some perspective on the background of the Department of Public Health at NDSU?
Sure. The Department of Public Health at NDSU is actually a relatively new and young department. It was founded about 2012 and became accredited to deliver a Master's of Public Health program in 2016. And so we've really only been around for 4 or 5 years as an accredited program. We currently have 2 specializations that we offer, a Master of Public Health and Community Health Sciences and a Master of Public Health and Epidemiology. And the interesting thing about the Master of Public Health and Epidemiology is that we actually had a Management of Infectious Disease specialization, which Dr. Carson talked about founding back when he first arrived, and a Food Safety specialization, which both actually have a lot of common foundation in epidemiology and epidemiologic methods. And so we put the 2 together to offer a Master of Public Health and Epidemiology, which is really common at pretty much every other accredited school or program of public health. And we also offer a number of graduate certificates in American Indian Public Health and Management of Infectious Diseases, in general public health for public health professionals who maybe don't have the time or the resources to come back and do a full Master of Public Health, but they can still get some graduate education in those areas. We also offer some other degrees, a dual degree for PharmDs and to earn a Master of Public Health simultaneously. And we have some new accelerated bachelor's program. So a student can earn their bachelor's degree and a Master of Public Health in about 5 years. And this has been a really exciting opportunity to get public health in front of undergraduate students, because a lot of undergraduate students do not come into their work thinking about, oh, I'm going to be a public health professional. If they're thinking about health at all, they're thinking about, pre-med or pre-nursing or something like that. And we have now created some opportunities for students who are in microbiology, emergency management, dietetics to actually do this accelerated program. And so we've got new students coming in more quickly straight from their undergrad at NDSU. We also have a public health minor that we offer to undergraduates. So again, getting public health in front of undergraduate students to say, hey, here's a potential career path for you to pursue.
Never before has probably the profession of public health been so thrust into our daily consciousness, right? And you just spoke to, I think now the possibilities, or for students that are recognizing, oh, there's this profession, but this profession does live long before or long after we're in a global pandemic. So can you just reflect a little bit of what does a day in the life of a public health professional look like when you're not chasing a pandemic and the kind of environment we've been in over the last several months?
Yeah. Public health is everywhere. Public health is everything. It's not just infectious diseases. It's not just global pandemics. Like I said before, we offer a Master of Public Health and Community Health Sciences. And so we're training students in a variety of different ways to work in a variety of different capacities. And public health professionals work in all sorts of settings and all sorts of roles. So they might work at a local public health or a state public health department, but they also work for tribal agencies, tribal health directors. They work in community organizations. They work in healthcare delivery settings, doing a variety of different things. So they could be managing, developing and managing tobacco prevention programs or suicide prevention programs. They could be working with our women, infants, and children nutrition program, supporting pregnant women and infants to have healthier starts. And so they work in a variety of different roles. I'm an epidemiologist, so let me talk a little bit about what an epidemiologist might do in a standard day. Again, they can work in a variety of different roles, but one of the ones we see most often is they'll work in a state health department or a local public health department as really sort of a research arm of public health. And epidemiology has often been called the science of public health. And so an epidemiologist in a state health department could be quite likely in charge of implementing, managing a data collection program. So maybe it's something to be monitoring cancer cases in the state of North Dakota, or to monitor birth defects or something like that. And so they're in charge of really working with either collecting data or accessing other data systems that are already in place in the state. And they do a fair bit of data collection as well as the data analysis and identifying, things that are coming up that we didn't realize. So it's sort of like the rise of the opioid deaths that were occurring in the state and all across the country. Epidemiologists are often the ones who notice those patterns and notice those trends. They're also looking at data, trying to understand who is most at risk for a particular disease or a health condition, or something like that. They're looking at different risk factors or protective factors. And so how do we then implement this science? How do we understand how best to work with our populations, with our healthcare systems, with our public health units to either prevent these things from happening or to intervene and mitigate the potential poorer outcomes that might come from those things. So they're very hands-on with data, very hands-on sort of in the research world, writing up potentially research papers. More often it's research briefs, again, to help state legislators or to help the state leadership to understand why we might need to do particular things, why we might need funding to do particular things. So they're very data oriented and very sharing the science oriented.
Pamela Jo, thank you very much for joining us today and sharing more about your department at NDSU, and we wish you and your students all the best in moving forward. Thank you.
Thank you, Don.
We'll hear more from Pamela Jo about the future of public health later in the program. As Pamela Jo indicated, when the pandemic hit, leaders within the department were well positioned to help. Let's take a look at the critical role the NDSU community members played in helping reduce and slow the virus's spread.
It all started about a year ago with the announcement that there was a novel coronavirus strain that was causing pneumonia in China. In the public health world, we say that the next pandemic is only a plane ride away. And so knowing how people travel, we knew that it was only a matter of time before it came into North Dakota. And we knew that it was only a matter of time before we had enough cases where our current staffing would become overwhelmed.
There was a lot that was unknown. So there was a lot that was tense, like, you know, how aggressive do you lock down? How widespread do you test, for example? And so you can see different states approach this very, very differently.
Knowing how cases grow and how quickly they can grow, we knew that we needed to build a workforce. And when you start thinking about building a workforce, who is it that can fill that need?
We at NDSU, in our graduate program in public health, had one of the few infectious disease training tracks in the country. So we were already training the next generation of public health experts in an area that was tailor-fit to this pandemic.
And so we were asked to employ 100 contact tracers as fast as we possibly could.
Hi, I'm calling from Fargo-Cass Public Health. How are you doing today?
I sent out an email to the rest of the College of Health Professions students, so nursing, pharmacy, allied health sciences, looking for volunteers. That email got forwarded across the entire NDSU campus. And so my inbox filled up with over 300 students and some faculty asking, how can I get involved? I'd love to volunteer. How can I be a part of this? And from the health department standpoint, these were students who were not just coming in as blank slates. And so our students were really well positioned in public health to really start immediately. We have a lot of international students from Nepal, India, Bangladesh, from African countries, Kenya, Nigeria, South America, a variety of different locations our students come from.
Hello, म Fargo-Cass Public Healthबाट बोल्दैछु सरगम बोल्दैछु मैले हजुरलाई कल गरेको चाहिँ हजुरको रिसेन्ट कोभिड टेस्ट रिजल्ट्सहरु हाम्रोमा आएको छ हजुरलाई नोटिफिकेसन
Having the bilingual students helps with a variety of things. So first and foremost, for people who don't speak English as their first language, we're able to give them the information that they need in a way that they're able to understand it. It also helps them build trust, to know that there are people in our community who speak their language or who are maybe from their home country.
We don't want to, none of us want to live in masks forever, distance 6 to 12 feet apart and not gathering for, weddings and funerals and celebrations and football games and so on. None of us want that life to go on any longer than it has to. But it was very important to educate that those things kicking the can down the road was a very good strategy, because we knew that not that far down the road there was very likely efficacious vaccines and treatments that were going to come. So it was trying to kind of help people shoulder that burden and kind of bear up to what we had to do to try and decrease the spread till we get to that point of better vaccines and treatments.
Wow, what a powerful example of NDSU's land grant mission at work. And what an incredible experience for our students. One we never could have anticipated they'd receive. Earlier, I was also able to meet with Dr. Paul Carson, whom you saw in the video, to discuss his research and the work he's been doing to help educate the public about the virus and immunizations. Let's take a look.
I'm joined now today with Dr. Paul Carson, professor of practice at NDSU's Department of Public Health and the College of Health Professions. And Paul, thanks for joining us. This really has been quite a year, I'm sure, for you and your colleagues in navigating the COVID-19 pandemic. We heard earlier from some of our about the work that our students have been doing in contact tracing, but can you just reflect on the year past and some of the projects that you are now have been working on and are now working on as we continue to move forward?
Certainly. Great to be with you, John, and to get to talk to everyone about our program. I'm enormously proud of our students and the role they've been able to play in this pandemic. Would have never really foreseen just how enormously involved they would be. And just to kind of reflect back a little bit, from my past, when I graduated from medical school a long time ago in the 1980s, and I was thinking about pursuing infectious diseases, I was told by a number of my mentors that it really wasn't a good idea for a specialty to go into because vaccines and antibiotics were going to make that job a thing of the past. I likely wouldn't be able to find a work. But I was still interested in it, and I think it's pretty safe to say there's a lot of job security in trying to contend with infectious diseases. We didn't foresee at that time the explosion that would come from HIV and then Lyme disease and Ebola and Zika, now the original SARS, now this new SARS, and on and on. We've had so many emerging infectious diseases. And I was fortunate enough to come to NDSU in 2013 and help to build this new section of our Department of Public Health on management of infectious diseases in public health. And as part of that, we train our students, our graduate students, on, for example, how to prepare for, prevent, mitigate pandemic threats from infectious diseases. And when we first started hearing about SARS-CoV-2 coming out of China and then starting to make its way into other parts of the world, I was very nervous that this was the next big thing that we had been talking about. And when it hit the coasts, and especially when I saw it tear through a nursing home in the state of Washington, and I'm a medical director of a nursing home here in town, I became very nervous about what the future held. And then it was just a roller coaster ride since then with lots of different work. To talk about some of those things, early on, we do a lot of work with the health department. We've done a number of different grants and research projects and quality improvement projects in the state to vaccinate better, to use antibiotics better, to decrease infectious diseases. And so they turned to us pretty early on for help to fight SARS-CoV-2. And one of the things that happened, right away was that I got engaged as a consultant to the health department and also to the governor's office on this. And all these questions started to emerging. Are masks helpful or aren't they? Is hydroxychloroquine a useful drug or isn't it? Is there asymptomatic transmission of the virus or isn't it? Now, we've come a long way since then, but we were just asking those questions and learning. And so I pulled in my graduate students to, prepare science briefs on what we knew and summarize the current literature and try and put that into a digestible form for all these health department workers in the governor's office to be able to start making some intelligent decisions early on. And my students, I think I was so proud of them, and they were so happy to see that they had skills and expertise and knowledge on how to kind of review this type of literature and put it together in a way that was being immediately used by people that were making policy decisions early on. That was one of the first things we did, and I think was very, very helpful, and our students were able to provide a great service to the state.
That story, I think, really points to truly what a land-grant research university is all about. And when you think about the mission that goes all the way back to why such an idea was even formed in the first place. It's certainly about education. It's about research for our citizens and the communities of which we serve, and then it's about disseminating that information and getting back out into the communities in the region that we support. And have you gained an even greater appreciation for the value of a research and public service kind of university like NDSU, and what does our community and take away from that and this this experience over the past year and what that means?
Yeah, that's a great question. And so when I first came to NDSU, the sort of mission of a land-grant university was kind of new to me. And that idea that we are training people to have skills and expertise and do research that is applicable to the needs of the state and the needs of its citizens just became so vividly apparent to me with this. And I'd say probably the next sort of project I would mention that's just right in line with that is that when the Centers for Disease Control was realizing how this virus was spreading, needing immediate knowledge and research to understand the epidemiology of this and to start designing interventions to prevent this, they put a lot of funding. This was in part through the CARES Act and through expanding some of their research activities already out to the states. And the state health department came to us wanting to partner on what has now become a $1.4 million grant that's going to be a collaboration and partnership between the University of North Dakota and North Dakota State University to study where we've been and make projections to where we're going with this. And so we're about to undertake a very large study that will involve a number of our graduate students and several faculty members from both universities to take representative households from across the state and assess, the infection rates there, both by interviews and history, but also by blood samples, where we're going to, test to see how many are already immune to the virus, and we're going to be doing that in a fairly sophisticated way that will gain a little more knowledge than just antibody testing, but some more sophisticated immune assessments there. And as the vaccine rolls out, we will see what that does to the population, and then that'll give us a much better idea to predict who remains susceptible and what kind of interventions do we have to do for the state to modify our policies and practices to protect who remains susceptible. And this grant was very specifically not so much for just research and gaining of knowledge, but to be directly applicable to how we modify policy in the state. And we've been working with the state on this, and that project is just about to roll out. And there's been many others. One of the other ones I will mention that's really been driven by one of my colleagues, who's the chair of the microbiology department, Dr. John McAvoy, and I've been working with him a lot on this, is looking at our wastewater testing to see if that can be a much more cost-effective tool for population surveillance of the virus, rather than mass testing centers trying to get individuals to come in and all the vagaries that go with that. And we're learning a lot about how we can maybe use wastewater to be a much more cost-effective means to find there's a hot spot here in the state. We need to target our interventions there and hopefully save the state a lot of money. So those are just a couple of the projects that we've been working on and involving our graduate students with that have been, I think, immediately in that sort of wheelhouse of a land-grant university.
Yeah, so last question for you. What I think many in our community think about is the student experience. I mean, we were all a student at a college or a university. Certainly, we're talking with the NDSU community. Can you just reflect briefly on this time to be a student in public health, and this is the environment that they're a part of? I mean, what kind of meaningful impact and experience do you think that is for them?
Yeah, so I've thought about this quite a bit because, there's actually some research that looks at what makes people happy in their work, what brings sort of joy in your work. Actually, money, is not that big of a driver of it. It has to be equitable and fair. But the two things that are actually more predictive of sort of joy in your work is mastery, that I'm good at what I do, and purpose, that what I do matters and has meaning. And that has just come home in spades for our students. They can immediately see that what they are doing matters and that they're gaining the skills to do it. We've had a lot of fun in class, like with immediate questions about epidemiology, practice, policies that have immediate direct applicability, and they see, I've got some skills here to know how to address this. And that's a very, very gratifying experience for the students, and for me as one of their professors.
That's a great story. Paul, thank you very much for joining us today, and we wish you all the best on your research work and your students as you move forward. Please stay in touch.
Great. Glad to be with you. Thank you.
These stories about our faculty and students are certainly great testaments to the impact of the NDSU community. And Dr. Brashani, how proud does this make you as the leader of the institution, and to just reflect on the impact our students and faculty are having?
Well, it's not just a matter of pride. It's being thankful. We have some of the leading people, not just in Fargo, not just in North Dakota, in the nation here at North Dakota State University, changing the lives and the futures of countless people. But that's what research universities do. That's what land-grant research universities do better than anybody else in the nation, and that's what I'm proud of. What we do here matters.
Yeah, it's a great story, and we do have one of our students that we're very proud of here with us today. And I'd like to introduce Brenda Vincent, who's with us. And Brenda is a PhD student in the statistics program in the College of Science and Mathematics. Brenda has an undergraduate in mathematics and a master's in biostatistics. So Brenda, thank you so much for being here today.
Thanks for having me. It's great to be here.
So let's start by having you explain the research that you have worked on with the North Dakota Department of Health.
Absolutely. So when everything kind of got started in the state, things sort of got out of hand very quickly, and there's a lot of data that is being brought into the state. And I have previously worked with Dr. Carson, who we've heard from today, and Dr. Carson was working with the Department of Health, and the conversation really started that we could really use some more support to actually analyze this data. So I got brought in, myself and my advisor, Dr. Choi from the Department of Statistics, and we were originally working with the Department of Health to try to build a model to predict the number of cases, hospitalizations, and deaths that are going to occur in the state in the next upcoming 30 days. So to do this, what we were doing is, as we were getting this information of this case information and these hospitalizations and this death information, we were trying to build a model that would kind of see what that trajectory looks like and see if we can predict out what's going to happen in the next 30 days. Now, the key with this is that things change, and they change for lots of reasons. And so this is something that was a very fluid process. And as we got more information, we updated our model. And the whole goal of this was just really to provide support to the Department of Health so that they can start to look at where should they be focusing resources and that sort of thing. So that was where things started with the Department of Health.
So you talk of change, a real life, real-time situation. As the pandemic has continued to evolve, how has your own research and projects evolved as well?
Yeah, so as that original model building process, it's still ongoing, but we've started to shift our attention towards looking at outcomes related to COVID-19. So. Well, one of the projects I was actually involved in, Dr. Carson mentioned, which is looking at the wastewater and trying to use that wastewater information to do some population level surveillance. So my whole goal with using that data is trying to predict, how can we look at that wastewater data, the amount of the SARS-CoV-2 virus in the water, and how can we use that to predict the overall number of cases in an area, right? Because right now we're doing individual testing, and that's not necessarily a sustainable option for the long term. So that's one project. Another project I'm involved in is looking at women who were pregnant with COVID-19 and looking at how the outcomes of their infants might be different than if they had not had COVID-19. So to do that, we looked at birth record data for women who were born or who gave birth in the state of North Dakota in 2020. And we were looking at just what happened to their infants and that if they had COVID-19. We're looking at things like NICU stays, having low birth weight, that sort of thing. So that's still in process, and so we're still looking to understand that. Sure. And the final project that we're currently working on is looking at how college students experience quarantine and how they may feel burdened by it. So what I mean by that is, right, so this is more so last semester now that we only have 3 cases, but when a person comes in close contact with someone who has COVID-19, they're supposed to quarantine. Well, quarantining as a college student comes with its challenges, and for anybody. But we wanted to understand what experiences college students had during that, and if there's anything we can do to help alleviate that burden. So we looked at things like healthy behaviors, eating good foods, physical activity, stress, concerns about money, concerns about school, that sort of thing. So that's kind of where things are right now.
Well, it's really been quite a year for you, and certainly an experience that probably was unanticipated, right? As you pursue your education and research work. I mean, not everybody gets to work in a pandemic and learn things along the way. Yeah. Just as you reflect back and think about what have you learned the most, or how has this really changed you in your own passions?
Yeah, I mean, you're absolutely right. I never would have thought that I would have had the opportunity to work with such live data in the middle of a pandemic, but here we are. I think that, I've always been very passionate about what is that intersection between how can we use data to help improve health. And the fact that we have an opportunity to look at that while, the events are rapidly unfolding has been just instrumental to, I've had, it's been so rewarding for me. And, I've never experienced working with data that is changing so rapidly. So that has been something that, has been a huge opportunity for my professional growth of how do we deal with a data set that changes, and how do you use your statistical method that may no longer be valid as soon as you get the new data. So thinking about how to use information as it comes in, and just thinking bigger picture, like how can statisticians like myself or data, people who use data, how can they help improve the lives of people? And that's something that I've, will always take away from my experience working with Department of Health, and I hope to take with me into my future.
Those are great stories and great examples of real-time research in a real-time environment that's unfolding. So, Dr. Brashani, I want to come back to you. You've heard these stories, certainly in a focused area. NDSU is very broad, diverse, and has expertise and the ability to impact our community and regions, in so many different areas. But what do you take away from these stories and from the pandemic and the work of our faculty and students?
Well, I think the most exciting revelation that people are starting to get, and what you were just talking about illustrates, people portray higher education as being this monolithic, slow beast, the ship in the night that takes years and years to turn. And in hours and days, we turned and started solving a state, national, and worldwide health crisis. That's what research universities can do. We're extremely dynamic and nimble when we need to be, and responsive to the people that we serve. And it's going to be hard for people to forget that for a while.
Wouldn't be possible without your leadership. So thank you for all you do for NDSU and leading our students and faculty and programs. So honored to have you with us today.
And thank you all. And thank you for the people that make it happen.
Brenda, thank you very much for being with us today. Really appreciate your stories. So,
it was my pleasure. Thank you.
I hope the stories you've seen and heard during this program provided insight into the ways our students, faculty, and staff have been working to track, understand, and solve the COVID-19 problem. We're going to return now to a closing conversation with Dr. Johnson and Dr. Carson as they provided good insight into the future for their programs and these future health professionals. Let's listen.
So today we've reflected on the work of the department in the past year, and certainly it's been quite a year with the COVID-19 pandemic. I'd like to ask both of you, Paul and Pamela Jo, to share a few final words and reflections on kind of the future and what's happening. So Paul, I'll start with you. We're in vaccine rollout now. We reflect a little bit on the impact that our students have had, and then certainly thinking about post-pandemic and what the world looks like as we look out into the future. Can you just share some reflections on those things?
Sure, be glad to. So for the immediate future, our we're going to be very involved with issues around, we have been and will continue to be very involved with issues around the vaccine rollout. We have within our Department of Public Health a Center for Immunization Research and Education, and this new vaccine has posed a lot of work for our center. And a couple of our really sharp former graduates staff that center and have been heavily involved with providing FAQs for the state and for healthcare providers, putting together educational materials for the nursing school, pharmacy school, medical school, educating primary care physicians. That work will continue. You know, we're dealing with, you know, concerns about the vaccine, safety about the vaccine, some misinformation about the vaccine. That's going to be an ongoing immediate amount of work. You know, we've had some of our students, you know, really be showcased in the work that's being done around this. You know, one of our students comes to mind in particular, Sargam Gamiri. Sargam is finishing up her MPH. She's originally from Nepal. And when the outbreak hit, you know, a number of different communities and peoples in North Dakota, one of the places that was hit hard were some of our manufacturing sector, where a lot of our new Americans work. And one of the kind of more publicized outbreaks was in a factory in Grand Forks that had a lot of Nepalese workers there. And they found that our student who was doing contact tracing was just instrumental in helping, you know, that community understand what was happening, how to quarantine, where and how to get tested, why these things were happening. And they were so pleased with how she was able to help them navigate that they asked to hire her immediately, you know, with our county health department and sort of lead some of that work with some of our new American communities, which has just been great. I see that work continuing on. In the more big picture, you know, this pandemic really exposed America's vulnerabilities to a pandemic. It showed that, you know, things that we thought maybe we had well prepared for in many areas weren't as well prepared as we wanted and hoped for. I think there's going to be a lot more attention on this now. A lot of us doing research we're going to be researching the lessons learned from COVID for the next 10 years. But that work is going to be directly applicable to trying to do much better at preventing the next pandemic, whether that's a new SARS coronavirus type or a pandemic influenza or, you know, the things like Zika or Ebola or something we haven't foreseen yet. And our graduates, I think, are going to be a very hot commodity for that kind of work. There's going to be a lot of desire, I think, to have people who are trained in epidemiology, trained in infectious diseases, to work in health departments, work for the CDC, work for the World Health Organization, for a lot of the non-governmental organizations that are working in this area. And they're going to play a big role going forward into the future.
Thank you, Paul. You know, Pamela, Joe, I'm just reflecting that this past year, no doubt, disrupts, probably in a positive way, the role of the public health program at NDSU and its future impact. And can you just, you know, with some final words here for our program, just reflect on the future of the Department of Public Health at NDSU, its relevance, its future impact, and why it matters so much?
Yeah, you know, for better or for worse, as you noted earlier, the global pandemic has really shown a spotlight on public health and epidemiology and the work that public health professionals do. And so, you know, with our new MPH in epidemiology, we now have a research-based program that we're offering. And we just enrolled our first cohort this past fall into the epidemiology program. And a number of our current students actually switched over to the epidemiology program in order to take the new epidemiology courses before they graduated. And so, you know, that was a first sign that even our current students were really interested in these new skills for going out into their careers. One of the other nice things about having now a research-focused MPH that we're offering is it's our opportunity to build upon that to create a PhD program. And as Dr. Carson just mentioned, there's going to be a lot of research as we are moving forward in the next couple of years, the next decades, that's going to require skilled researchers at an even higher level than a master's of public health. And so having a PhD program in epidemiology, with our focus in infectious disease, is really going to help us prepare future research workforce as well. And so that's I think a very exciting thing from our department. One of the things we've also noticed as we're starting to look at admissions for next year is we have our largest pool of applicants that we've ever had for our program, our Masters of Public Health program. And I will have to say the vast majority are looking to enter our epidemiology program. And so I think that speaks to people's recognition of the importance of this program. I think it speaks to the importance of us having a focus on infectious disease epidemiology here. And so people from around the country, around the world, are actually applying to our program and want to come study with us here at NDSU.
That's fantastic to hear as we wrap up this wonderful conversation with both of you. Pamela, Joe, Paul, we are grateful for your contributions and service to our communities in the state, to the university educating our students, and the future research. So really appreciate the time to have this conversation, and we wish you both all the best. Thank you.
Thanks, John. Thanks for having us.
Great to be with you.
When students have access to opportunity in a culture where work ethic means everything, there's no limit to how far they can reach, no threshold they can't break through. At NDSU, we put the power of knowledge in the hands of our students, but access to that power is in your hands. Support our students by making a gift today at inourhandsndsu.com.
Throughout the program, you've seen the power of an NDSU education. And if you're a graduate, you've experienced it firsthand. When we launched In Our Hands, the campaign for North Dakota State University, we had a vision to create countless opportunities for students to learn and grow. We wanted to shape a more diverse landscape for them to explore, and we knew that building a stronger NDSU would lift up all of North Dakota, the region, and beyond. We certainly didn't envision a pandemic coming along to disrupt our lives and livelihoods and our campaign. But I'm so inspired by the perseverance of our bison herd and a desire to participate in making a difference for our community. Your support to the campaign helps ensure the great work you've seen today continues well into the future. But we're not finished. President Brashani and I would like your help. To get involved and find out more about how philanthropy is helping enhance the NDSU experience, visit inourhandsndsu.com. Thank you for joining us today. And thank you to our guests for sharing their talents with NDSU and their stories with us. Later today, we invite you to see philanthropy in action and join Scott Bollier, NDSU's Ronald and Kay Olson Dean of Business, for the Menard Family Distinguished Speaker Series, featuring Dr. Emily Chamley-Wright, President and CEO of the Institute for Humane Studies. The Menard Family Distinguished Speaker Series is part of the Sheila and Robert Challey Institute for Global Innovation and Growth, all made possible through philanthropy. You can still register at ndsu.edu/Challey Institute. We'll leave you now with our favorite Bison Art singers and a closing performance of The Yellow and the Green.
Oh, cheer for green.